Hi, my name is Joy Dolan. I am a PharmD student at North Dakota State University. Today I will be walking you through the Canadian Network for Mood and Anxiety Treatments, CANMAT, guidelines. These were published in 2016 by the Canadian Journal of Psychiatry, and they are clinical guidelines for the management of adults with major depressive disorder. So these guidelines were more of a research study doing a systematic review and meta-analysis and really combining them in to get the best, or what they consider like the best treatments for major depressive disorder. It's kind of formulated very much as a research study with background methods and results. This may make it a little more difficult to navigate, but it still has 4 main sections, which include the major principles of pharmacological management and like kind of choosing a first-line antidepressant. And then the second, comparing the different medications on their tolerability. Third, practical approaches like drug-drug interactions. And then 4, how to manage inadequate responses and treatment resistance. So those are kind of the 4 main sections. And it also concludes that there are different limitations for the patient-based. So really the first one kind of introduces who should be treated with antidepressants and what new antidepressants there are. This guideline mainly focuses on second generation medications, so more of the newer rather than the old MAOIs or TCAs. First off, in table 1, it gives you the levels of evidence, which is really handy so that you know kind of where it's coming from in that, and it tells you how much evidence there is backing something and the definition of that. It also gives you the list of what they consider first-line antidepressants and second-line and third-line, so you can easily treat a patient based on that. And it also gives you clinical factors to consider. Figure 1 is very helpful. This basically walks you through the basic step-by-step process for choosing an antidepressant. Are they on any other medications that might have a drug-drug interaction? And then are there any side effects? Whether it be sexual dysfunction or things that the patient is concerned about. And then you can select and initiate one of those first line options. So it really lays it out for you. What do you do when somebody comes in? Some of the shortcomings of this guideline is that it doesn't really have a table of contents. It does break down those 4 sections, but it can be a little more difficult to navigate. There also were no specific population. This is really for all adults with antidepressive disorder. There were no special guideline recommendations based on age, sex, ethnicity. So then walking you through, table 5 I found as a clinical pearl because it can help you identify different patients if they have comorbid conditions and what to give them for that with the level of evidence based on that. So if it's a sleep disturbance, you have the ones that can maybe potentially help with sleep. Same with anxiety, very common conditions, and this kind of breaks down what you could possibly give for that and the level of evidence. So then the next clinical pearl that I have is that remembering no antidepressant has been found superior in curing functional anxiety. So just making sure that all antidepressants can be used in many different people. And then finally, this table breaks down when to initiate, or like once you've gotten first line treatment, have they improved? Have they not? When to consider switching medications to a second or third line, or switching to an antidepressant with superior efficacy, or adding adjunctively. And so once you've had that, it's like after 2 to 4 weeks, they kind of recommended. They have a little table that says in table 12, which is my second clinical pearl, that shows you exactly when you might want to try switching to another agent versus adding adjunctive medication like an antipsychotic, a second-gen antipsychotic. And I think that's really helpful. Finally, it gives you guidelines on how to manage chronic and persistent depression, as well as this new treatment of esketamine, which is what we're going to be looking at in the future. So thanks for listening. Hope you have a great day.